Thank you very much, Dr. Saxton, for that wonderful introduction, and welcome to all of you who are watching this presentation for today. So again, I'm Dr. 𝐒𝐂𝐁𝐄 Gonzalez, and today we will be talking about how to talk to your physician about your pain. So I'll bring up my presentation here. When you're kind of thinking about what you've been through as a patient or a person with lived experiments, how many times have you been to see a healthcare provider, that could be a physical therapist, could be a physician, and actually left feeling a lot more confused about your diagnosis and even what the next steps are? Well, this is what we really hope to address in today's presentation. And while a physician-patient interaction is a two-way street, really the most control that you have is in this situation is what you do or say. And that's what we're going to be focusing on today. So the objectives for today's presentation is that you will watch a doctor-patient role play, and then you will learn to identify factors that can affect your assessment prior to, after, and at the end of the appointment. And then we'll watch another role play at the end, demonstrating some of those actions to address those specific factors. From a when you're watching the role play, please consider the following and really focus on the patient. So again, this is about what you as a patient can do and not necessarily how the doctor can do things differently. So when you're looking at this, really pay attention to what factors might be influencing this interaction. What could you or the patient do to prepare to help with this interaction? And is there anything that they could have done differently to improve this interaction? During this role play, please send your answers to some of those questions to question@painab.ca. And then that way it'll be, those questions will be read out loud, or the comments will be read out loud, and we'll see if those will be addressed during the presentation. Dr. Qian Yan will be playing the role of Dr. Jim, who's a family physician, and Feline will be playing the role of a patient named Sarah with hip pain. And action.
Good morning. Hi, Sarah.
Hi, Dr. Jim.
Hi, it's been almost a year since I saw you last. It seems like forever. How are things? How are the kids doing?
Well, doctor, it's been quite a year with the pandemic. Things have changed a lot. You know, the kids have been at home schooling from the house as opposed to school. And well, it's just been a very different year. It's been a little rough.
This last year has been challenging for a lot of people. So what can I do for you today?
Well, you know, I have pain in the hip and I wasn't able to get in to see you. So I went to a Mediclinic and I got some x-rays about 6 months ago, and they said that I have hip arthritis. I think it was called mild arthritis, but I can't see how anything this painful could be called mild. I mean, it's just been getting worse.
That's really too bad. So when did this start?
Oh, it was about a year ago. Oh, let's see here. I'm not certain what I did wrong. I mean, I think it started slowly. You know, I didn't think about it much then, but it did get worse after a long hiking trip that I went on. Not really clear. I mean, I did a lot of hiking and I sort of remember slipping on some loose stones. I caught myself on the gravel. I mean, it's getting so much worse since then.
Okay, so when you slipped on the gravel, did you hit the ground?
No, I caught myself, but I mean, it really stretched, you know, my whole body in that area. It was really sore. I was able to continue though. I mean, I finished the hike, you know, later that day. It was terrible. And, you know, it's been on and off, but lately it's just been constant.
Okay, so where's the pain exactly?
Oh, it's all around my right hip and my leg. It's worse now. I mean, it's like a 9 out of 10 of pain every day. And, you know, and in the last 6 months, it's been every day.
All right. And what's the pain like? So if you were to describe it, would you say dull, achy, sharp stabbing, burning electrical?
I don't know. It's just ridiculously painful. You know, just what you'd expect from arthritis.
Oh, okay. Okay, when you say just like arthritis, what do you mean by that exactly?
Oh, I mean, sometimes it feels like meat hooks and like the bones are just getting crushed. I mean, and more recently, it's just debilitating. I mean, and you know, I can take a lot of pain.
All right. And do you have any numbness or tingling?
Oh yeah, I mean, the whole leg from top to bottom. But what's bothering me is the pain. You know, it's so bad it's affecting my work, and I've been missing some days.
Well, that's not very good. All right. And what makes the pain worse?
Well, I mean, I just told you. I mean, pretty much everything. You know, when you get to the point that affects you, you know, your work. I mean, you know that the arthritis is progressing. In fact, my cousin, who's the same age as me, and you know, he had hip arthritis and he had hip surgery, and I mean, it just did wonders for him. You know, and I also saw a massage therapist who said that the muscles could be this tight only if it was like severe arthritis. You know, he was surprised when the x-ray said that it was only mild arthritis and it hadn't gotten worse. You know, maybe an MRI scan would like show, you know, what's going on in there and why things have been getting worse. You know, and then if, you know, an orthopedic surgeon could fix it and I could get back to, you know, how I was before.
Okay, wait. Sorry, could I just clarify some things? Is the pain worse with standing for a long time or sitting for a long time?
I don't know. I mean, it's painful both ways. I mean, maybe a little, I don't know. It's just so hard.
Okay. All right. So just revisiting this. So when you say hip pain, is it more on the side or in the groin or the back?
Well, it's just in the hip, like where the arthritis is. And you know, I'd like to be referred to see a surgeon about this. Um, you know, you could help me by referring me to see a surgeon. They could get to the bottom of this, and I just think my life would be so much better.
Okay. Prior to that, have you tried doing some strengthening exercises or physiotherapy yet? I think this would be a helpful first step.
You know, it's been so stressful and I've been so busy. I really haven't had any time. And, you know, I'm so exhausted after work. I'm so done that I can barely do anything. I can barely, you know, sit. Sometimes I have to lie down, and even that can be painful. And besides, you know what? I don't want to cause further damage. I mean, I'll be able to exercise after surgery, right? I mean, and you know, the other thing is I have gained a little bit of weight, and I know that's not great with arthritis.
Okay. It will take some time to see a surgeon. So in the meantime, I would suggest some physiotherapy.
You know, I really don't have time for physiotherapy. And like I said, I don't want to cause any more damage than I already have.
All right. So, okay, so I'm not certain about all this yet. Okay, I think I should just get a little bit more information first. So, not every case of osteoarthritis necessarily benefits from seeing a surgeon.
You know, but I'm just sure if you referred me to a surgeon and I got an MRI, it would just show everything that's wrong with the hip.
All right, okay, hold a sec. Just a few more questions, okay? Have you had any fevers, chills, or night sweats?
No, and I'm not sure why this even matters. I mean, this is arthritis.
Okay, all right. You haven't had any recent physical traumas of any sort?
No,
Any swelling?
I don't know if I have swelling. I mean, sometimes I think my hip is swollen after activity.
Okay. All right. So is there anything else you would like to discuss at this appointment?
Yes, you know, my workplace refuses to give me accommodations. I mean, we know I have hip arthritis, and they're still saying that there's no way for me to do, you know, more sitting down types of roles. I mean, in the last 6 months, I've missed several days at work, and this is a problem because I am really the only breadwinner right now. My husband was laid off during the pandemic at the airport where he worked, and so it's been quite stressful, you know, with him not working. And I just feel like I'm doing so much. And, you know, I really don't know if I can continue going at this current pace. And work won't accommodate me. So I need you to fill out a short-term disability form. I work in corrections, and I know that there could be a sitting position for me somewhere, but work just won't help.
It sounds like it's been challenging. But with regards to the filling out of the form right now, I'm sorry, I have to address that on another day because I actually haven't allotted enough time to do this.
You really, you can't do it today?
Well, actually, forms are challenging. It does take some time to figure out the diagnosis exactly and to fill out the form properly, because you have to correlate the symptoms with your actual workplace and how it affects you. Your symptoms are a bit diffuse, and I'll have to get a bit more information about that and what we can suggest from a work perspective.
Well, we already know the diagnosis is hip arthritis. I mean, and having the same symptoms as other people with arthritis. I don't understand why this is so difficult.
Okay. In the meantime, okay, we'll bring you back to do a physical examination, and we'll discuss that a little bit further at that time. But in the meantime, there could be a consideration of looking into some pain management options. There could be a consideration of a hip injection with cortisone to help with becoming a bit more active and tolerate your work better.
I'm not interested in doing something if it's just short term.
Okay. All right. So, all right, here's the plan. We'll book you for this a special set of x-rays because the surgeons need this special type of x-rays for the hip. And we will send you to see a surgeon. But it will take a long time, maybe even a year to see them. Pain-wise, in the meantime, there's also consideration of oral medications, which could potential.
You know what? I want to go natural. I don't want to mask the pain and do more damage to myself.
All right. We'll give you a requisition for special hip x-rays, and we can refer you to a surgery. I will fill out the form when I bring you in next time and do a physical examination because I can't see you right now. And this may take a while however, and so I would encourage you that strengthening exercises will help you manage your pain and get you a little further, even if it is surgical in nature.
Okay, well, I guess I'll try, and I really hope that surgical referral appointment comes a lot sooner than a year.
All right. Thank you, Dr. Yin and Feline, for that role play. Now, let's kind of discuss some of the factors. So were there any comments that were sent in regards to some of the factors that might be involved in this interaction?
There aren't any comments just yet. I think people might be holding them for the end.
Okay. So, well, let's just go ahead and discuss some of the factors that we've seen in this. So I'm going to be organizing this part of the presentation to look at some of the factors to consider even before you go to your appointment, some of the factors to consider while you're at your appointment, and even other factors to consider at the end of the appointment. I would like for you to pay attention to the word actions kind of moving forward. I will highlight them in bold as far as different things that you can do as a patient or person with lived experience to kind of address or modify those specific factors. So let's consider first some of the things that you may want to consider prior to your appointment. Just as a small note here, that not only do these factors apply to you, this actually applies to anyone who you communicate with. So this could be your loved ones, it could be even the physician that you're talking to, or any other healthcare provider. A lot of these types of factors that apply to you can also apply to your healthcare provider as well. So I'll break down here a little bit of what we'll be talking about. So we'll talk about some pain beliefs. We'll talk about how your pain intensity, even prior to your appointment, can impact things. Any medical preconceptions that you have prior to your visit, psychosocial stressors, health-related conditions or limitations. What are your own roles and responsibilities? What are any transportation limitations, financial or even communication issues that may actually impact even you prior to your appointment, or will impact you even during your appointment? So pain beliefs. So there's a lot of different types of pain beliefs. I'm only going to be highlighting a few of them here today. So some pain beliefs include things like, hey, pain is a sign of weakness. I understand that even in the Southern Africa cultures, in some of the cultures there, that pain is actually taboo. So you don't even want to talk about it. I know that in some families even that, talking about pain, you don't do that. You're supposed to suck it up and just kind of move on and not even talk about your pain. And whereas other people just think they don't have to talk about it because other people must understand how much I hurt. They must be able to see what I look like, and I don't have to say much to them. One of the action items for this is that even if you feel like it may be a weakness, it actually can take a lot of strength to really talk about your pain. And it's actually very important to talk to your healthcare provider about your pain. They're not going to be able to come up with a good diagnosis and figure out the next steps if you're withholding a lot of information or you're scared to talk about your pain. So if you want to figure out what's happening and to figure out what to do next, I really encourage all of you to feel free to talk to your physician about your pain. And just because you may think that people understand how much you hurt, that may not be the case. And so the physician will, or the healthcare provider will likely ask you questions to elucidate that in more detail. Other pain beliefs include having pain means I must be broken or flawed. Pain is ruining my life and will ruin my future. The only worthwhile goal is to be pain-free. And I can't be happy as long as I have pain. These are very kind of negative or even pessimistic views about pain. And unfortunately, if you have these types of pain beliefs, even before you go into your assessment, this could actually impact your pain. And in fact, these types of beliefs can sometimes even worsen your pain experience. So one of the action items here is simply really keeping an open mind and finding ways to learn to live your life with meaning, even though you have pain. If you go into an assessment with this positive or more optimistic mindset, that actually opens up more possibilities or opportunities for you and to learn how to cope with pain. And then thinking about yourself in a negative, pessimistic way may worsen your pain experience and making coping more difficult. So make sure that you try to have an open mind and again, just to be a bit more optimistic. Although I also understand that it can sometimes feel very hard to do that when you're in as much pain as you are. Pain intensity. So this is an interesting one, is because even how much pain you're in can actually affect your ability to communicate or think. If that's the case, it's difficult to answer questions about your pain. And if your pain is too extreme, even being assessed can actually make it difficult. A doctor can't really assess you if your pain is an extreme 10 out of 10 pain and they can barely even touch you. So some of the action items, even before you go into your assessment, to think about is, one, you do not need to be in extreme pain to demonstrate how much pain you're in to your healthcare provider. They will ask you questions, or you'll be able to tell them through their questions, how much pain you're in. But if you're in too much pain, it's going to make it difficult for you to communicate your pain and can be difficult for them to assess your pain. So you don't have to be in extreme pain for that. So we actually encourage patients, take your pain medications, unless, of course, the pain medications take your pain away completely. If they take your pain away completely and you arrive with a 0 out of 10 pain, then that also makes it difficult for an assessment, because they may do an assessment and not actually find out where your pain is coming from. So just make sure to be aware of how much pain that you're in and not to be on either extremes. Medical preconceptions. So what I mean by this is, from a medical preconception standpoint, sometimes you will already go into an appointment with your healthcare provider and already have an idea as to the cause of your pain, or a disease diagnosis like osteoarthritis in the example here, in the role play example. This may be due to previous imaging. So she talked about having prior x-rays or a prior assessment from another healthcare provider, like a massage therapist, or someone else who has similar pain, like her cousin. And so now you go into this thinking, this is exactly what I have. If you go into that type of an interaction, it can actually affect how that interaction will go. And we'll talk about that in the section of during your appointment. Some things to kind of keep in mind with this is that imaging findings do not always match with the diagnosis of your actual pain generators. and such findings do not always need to be fixed. In fact, there have been studies looking at this to find out if the severity of arthritis seen on an X-ray or image actually correlates with someone's pain, and there doesn't seem to be that correlation. In other words, not all osteoarthritis seen on imaging is painful, but not all pain you have is automatically osteoarthritis. When it comes to preconceptions based on family, friends, or other people who may have similar pain, you really want to consider that there are other factors that you may not be aware of that can actually significantly change their diagnosis. And then other aspects too, a healthcare provider may have expertise in only one structure. So a massage therapist really is an expert in helping you treat the massage or muscle pains, but they're not necessarily experts in diagnosis. You have to be aware of that. In the next part of the presentation, during your appointment, I will go over different types of healthcare providers and some of their roles. So what are some of the things to do with your medical preconceptions? Number one, understand that your idea of a diagnosis may actually not be complete or accurate. And when you see your family doctor or your healthcare provider, please keep an open mind with them, because their diagnosis may be very different than what you expect or what other healthcare providers have told you. Psychosocial stressors. Believe it or not, stressors can actually have a negative impact on your assessment or treatment and can even significantly increase your pain. So I'm not sure, but I know a lot of my patients that I've seen, if they're not sleeping well, if there's a lot of anxiety or prior experiences to the medical system, perhaps there's a death in the family, if there's some relationship issues or stressors or family issues, or if there's time constraints. A lot of times, all those types of stressors can actually contribute or worsen your pain experience. And that then increases your pain intensity, makes it difficult for you to communicate, all of those things. And so it's really good to be aware of these things. And so this is some of the actions to consider when it comes to some of these psychosocial stressors that may be a part of your life before you meet with your physician. Depending on your healthcare provider's cancellation policy, you may want to actually consider calling them to reschedule your appointment to a better time. If you've had a recent death in the family, you may want to reschedule the appointment till later on where it's not affecting you so much. And then that way the healthcare provider has a better assessment of your pain and not being amplified because of some other stressor in your life. If you are not able to cancel your appointment, go to your appointment still and let your healthcare provider know what stress or what your situation is. So that way they can take that into context with your assessment. I've had patients come in saying after they had a huge stressor, someone passed away, they really couldn't actually talk to me very much. And so as we halfway through, it became very clear that the appointment wasn't going very well. So I actually offered to see them on a different day. And at least then I knew that, what they were presenting is very unique on that day, simply because they had a recent family member pass away. Health conditions or limitations. So there are other types of health conditions can actually impact your pain, make it worse, or even affect how you get assessed. Physical disabilities. So if you have some more physical disabilities that may not be pain related or may be pain related, that could actually delay getting your appointment. If you have difficulty getting out of a chair, moving around in your bed, or if you're in a wheelchair, it's going to be difficult for you to move on to an examination table. If you have heart and lung issues or cardiovascular issues, and you might have some breathing issues or endurance might not be so good, so that might delay you getting to your appointment. Depending on the assessment that you're getting, that may also impact your examination. Even cognitive issues. So if you're having memory issues, focus, concentration issues, if you go to your appointment and this is significantly worse that week or that day, then your healthcare provider may not get an accurate picture of what's going on. You might get confused as far as what they're suggesting or what they think it is, and it could just be an overall frustrating encounter. With that said, if there's nothing you can do to change that, then just have to be very compassionate to yourself that you're doing the best you can in that situation. So some action items when it comes to health conditions or limitations. Show up early to your appointment. Give yourself a bit of a buffer for any additional time needed to get to your appointment. So if you're taking the bus, but you have some mobility issues, you want to know where that bus stop is to where the clinic is so that you have time to get from point A to point B. And using Google walk instructions, if you have mobility issues, you're going to have to probably double or add some more time for that. Another thing that you can do to help with this is bring someone with you to your appointment. So if you have cognitive issues or difficulties from that standpoint, or mobility issues, that person could potentially help you from a mobility standpoint, or even help you to recall certain things, or just have another set of eyes or ears listening to the doctor so that they can explain things to you later. Roles and responsibilities. So your current roles and responsibilities could affect you in a number of different ways. For example, attending appointments, obtaining further investigations, or even getting subsequent treatments. So for example, roles and responsibilities include the role of being a mother or father, and having responsibilities as far as, you got to take your kids to school. If they're at home getting school, like in the example, then sometimes you need to be present there, especially if they're younger and can't be there on their own. If you're an employee or a business owner, so if you're working, so those are some responsibilities that you have. You may not be able to make the appointment, especially if it's after hours, or if you do, you may have to take time off of work for that. If you're a caregiver for a family friend or even a pet, those are other types of roles and responsibilities. And these are just to name a few of things that you may want to consider before getting to your appointment, because it'll be difficult, again, if you get to that appointment and you're constantly worried about what's happening to your roles or responsibilities. So an action here, make sure you make some arrangements beforehand, childcare, work coverage ahead of time to allow you to attend any medical appointments. And don't forget a backup plan. There's been a number of instances where I've had patients, they had to cancel at the last minute because that person that they relied on wasn't able to make it. Transportation limitations. So these are factors that can also negatively affect your appointment. If these factors come into play, you can actually end up being late or even miss your appointment altogether. Your pain may even worsen or trigger an exacerbation. For example, there's a lot of patients that I see who've been involved in motor vehicle accidents. And when they're involved in a motor vehicle accident, sometimes you can get post-traumatic stress disorder with this and driving anxiety. So imagine you're already in a lot of pain. Then you get into the car, you drive to your appointment, which may be 15 to 30 minutes away. You've tensed up the entire time. Your pain is worse. It goes right back to that pain intensity being too much for you to be assessed. So that can have an impact. Same thing with prolonged sitting with long distances. So maybe you didn't have a motor vehicle accident, but your pain is really bad whenever you sit for long periods of time. Not only are you sitting in the car to get there, but then now you're going to be sitting in the office waiting for your physician or seeing a physician. And if all of that is just exacerbating your pain, you really want to be aware of those things, and that may limit things. So some things to consider in that regard: how far do you actually live from your healthcare provider? Can you drive? Do you need to take public transportation? Do you need to take an airplane? And those are things to consider. From an action standpoint, as far as what can be done, you really want to know your transportation limitations and get the help and support if needed. Don't be afraid to ask for help. Keep in mind, too, that if someone else is helping you, you may need to make arrangements. They may need to make arrangements because of their own factors involved prior to your appointment, including their own roles and responsibilities. So make sure you're compassionate towards that. And if, despite all that, when you get there and let's say after driving or travel time, your pain is significantly worse for whatever reason, then you may want to arrive early to give yourself time to recover or recuperate. Otherwise, being in a pain exacerbation moment could actually make your assessment a bit more difficult. I've even suggested to patients who are coming from a long distance to try arriving even a day early. So that gives you time to rest so that you're nice and your pain is at a more manageable level by the time that we see you. There's also financial limitations to consider. Your financial situation can definitely have an impact on your assessment and your treatment, in that not all healthcare services are actually covered by the government or by Alberta Health Services. And there may be even other associated costs that you didn't think about. So for example, physicians are covered by the provincial government or by Alberta Health Services. However, treating therapists like physical therapy, occupational therapy, massage therapy, chiropractor, mental health therapists like psychologists are often not covered. but are often covered under private insurance. So make sure you're aware with that. Completing forms are often not covered by the provincial government. So you don't be surprised if you go into your family doctor's office and you actually see a list on the wall telling you the different fees that they charge. Other financial things to consider: is there even a cost to get there? Are you taking a taxi, bus, and plane? And even once you get there, is there free parking? Right? If there isn't free parking, maybe have a friend drop you off so you don't have to worry about that specific cost. So some of the actions: one, to be aware of that, to make sure you're prepared for these costs. But if you are unable to afford the fees for specific treatments, therapies, or even the forms, let your healthcare provider know this, because this could actually change some of your next steps. And also just be aware of any of those other additional costs that you might have before when you're arriving for your appointment. Communication issues. So if English is your second language, be aware how well you're able to communicate or able to understand English, because that can be a significant factor. I've definitely had patients in that category where it becomes difficult not only to elicit information from them, but then even to provide education about what the next steps are and to help them move forward. Along those same lines, maybe English is not your second language, but you have speaking difficulties. I've had patients with post-concussion syndrome have very significant stuttering issues. And if that's the case, or they take a long time to pause before answering questions, it may take actually more time to be able to get all the information. And so it could be multiple appointments before I'm able to come up with an accurate diagnosis or next steps. Are you able to read or write? This has not happened very often, but it has happened to me, where I've had a patient, they weren't even able to use a phone because they couldn't read or write, read numbers. And so if you find something like that out beforehand, know that that's going to significantly impact not only making appointments, because a lot of times we send texts out or emails or even letters for that, but even any educational materials or even then giving them requisitions to get things done. So you really want to be aware of that. And now in this day and age, especially with COVID-19, do you even have access to the internet? There's lots of treatments that talk about workshops or education materials online, that if they don't have access to the internet via computer or the telephone, it can be difficult to access those materials. So some action items for these communication issues are as simple as ask a family or friend or get a professional translator to attend your appointment to allow you to communicate as much information as you need so that the healthcare provider can get that information. Let your healthcare provider, if you have any of these communications issues, like for example, if you can't read or write, because that can make it difficult going forward, you might even need to bring a family or friend to help you with that. Let your healthcare provider know if you do not have access to the internet, especially if they're making some recommendations to things and they're talking about online workshops or whatnot. Know that even if you don't have access, personal access or private access to the internet, consider going to the library or ask family or friends if you can actually use their internet to access your resources. So that's kind of some of the things to consider even before you do your visit with your physician or healthcare provider. So now let's talk about things that you can do or factors to consider even during your visit. And I've broken this down into 3 different categories. So 1, managing your expectations of the visit itself, just being able to describe or talk about your pain itself, and then even discussing any fears, worries, or concerns you have about how your pain is affecting you. So let's talk about expectations. Expectations are broken down into 3 categories here. So you can have expectations of time, expectations of your healthcare provider's roles and responsibilities, and even expectations of your diagnosis of what investigations, treatments, or forms that you are wanting to get done. So what are your what are your expectations, I should say, in regards to your time? How much time do you have with your healthcare provider? Know that appointment times may actually include both face time as well as necessary paperwork before and after. Meaning, if you have an appointment for an hour with your healthcare provider, you may actually they may only see you for 45 minutes of that appointment, because the rest of the 50 minutes may be used to prepare for your appointment as well as to get all the paperwork done after your appointment. Know that part of that FaceTime when you see them is about taking a history and or a physical examination, and they need this first before they can even diagnose and treat your pain. And when it comes to forms, just like in our example, you may actually need more time. The family doctor may need more time to be able to complete the forms, complete their assessment before they can actually complete their forms. So it's really important to know how much time you have with your healthcare provider. Also know that if this is the first time, now in the role play example, this is a patient that they already they know about. So he didn't have to go through some of these other things, but if it's your first time seeing with the healthcare provider, they may have to ask you any previous medical or psychiatric conditions. I know that with psychiatric conditions, sometimes that can be something that patients may or not be willing to divulge or to express when it comes to that. But I do encourage you to let them know that if you do have any issues, the reason why is that those types of conditions can actually worsen or amplify the pain that you're going through. So if you have something like anxiety issues or mood or depression, for example, that's not well controlled, that can actually worsen the pain you're experiencing. It's not the cause of it, but it can definitely worsen it. They might ask you about prior medications or treatments, a family history of medical or psychiatric conditions, or even any smoking, alcohol, or recreational drug use, and they need that information to know how to help you to move forward. Of course, if your physician already knows you, they will not have to ask you again. So what are some action items or action things that you can do to manage this particular expectation of time? Ask how long your appointment is with the receptionist or your healthcare provider. Write down questions or concerns that you want to address with your healthcare provider, like forms, because this can help make your visit more efficient and time can be budgeted accordingly. What about your expectations of the healthcare provider? When you go see your healthcare provider, were you wanting a diagnosis? Were you wanting further investigations? Or is it even treatment that you're looking for? Know that depending on your healthcare provider, they may not be able to provide both or all three things because they may not be able to do any investigations either. So here's some examples of different specialties and what they can do. So a neurologist, for example, they're a non-surgical specialty, but they can come up with a non-surgical medical diagnosis and treatment, but they focus mostly on the nervous system. So that's the brain, the spinal cord, your nerves into your arms, into your legs. If you see a neurosurgeon, they are a surgical specialty and can do surgical or medical diagnoses and treatment of more of the nervous system. So brain surgeons, spinal cord issues. If it's an orthopedic surgeon, they are a surgical specialty that have the capability of doing surgical medical diagnoses, and they can treat kind of peripheral types of peripheral and axial. Axial, but I mean axial, that means more of your spine right towards the center, and that's mostly of the musculoskeletal system. So that's the bone, the muscles, the joints, even to the discs. A rheumatologist is non-surgical. They can also do a medical diagnosis and treatment, but they're more of systemic autoimmune or inflammatory conditions. That's when your own body is actually attacking itself, and even some axial or peripheral joints when that's happening too. And a physiatrist, that's my specialty. We actually, many of us, not all, but many of us do non-surgical medical diagnosis and treatments. So we all do that. Some of us do image-guided injections. We all have an understanding of rehabilitation process, so we can guide that. We also do and this focuses more on the peripheral axial musculoskeletal system. So that's bone, muscle, joint, and disc, and also the nervous system. When it comes to chiropractors, they are non-surgical but non-medical diagnosis and treatment of musculoskeletal disorders, especially when it relates to the spine. Physical therapists are also non-surgical, non-medical diagnosis and treatment of the musculoskeletal system. And massage therapists, like in the example of Sarah in our example, who went to a massage therapist and they thought it must be severe arthritis, they actually don't have any diagnostic capabilities. So they do not have the ability or have been trained necessarily to diagnose a specific causes of pain, but they are there for non-surgical treatment of muscle types of pain. So an action item when it comes to your expectations of your healthcare provider, if they do not tell you who they are or what they do, ask them their role so that you know what to expect or what their capabilities are of helping you in your journey with pain. And what about your expectations in regards to diagnosis, investigations, treatments, and forms? Not Note that medical preconceptions, so we've talked about that before, especially diagnosis, but sometimes you not only have preconceptions about what your diagnosis or disease is, but you may also have preconceptions about what you think you need. So what specific investigations. So Sarah was talking about wanting an MRI. She thinks she needs an MRI to help figure out what's happening, or treatments like surgery that she thinks that she needed. If you are adamant or persistent with your healthcare provider about these medical preconceptions before they even had a chance to complete their assessment, and you keep going back to it over and over again, that could actually derail the process of what the family doctor is trying to do, and it can actually lead them in the wrong direction or even the wrong diagnosis. Some of the things to keep in mind is that a working diagnosis and any subsequent investigations and treatments, they are all based on your healthcare provider's complete assessment. So they really can't, it's hard for them to make a specific diagnosis or any of those subsequent steps until they've completed their full assessment. And it does guide those the next steps as far as those investigations or treatments, and ultimately what to put on those forms, depending on what form that needs to be filled out. You may even get some things where some questions may even seem irrelevant or uncomfortable for you. However, it is relevant to the physician. For example, a positive history about sexually transmitted disease symptoms could actually lead to a diagnosis of reactive arthritis. So again, if you're feeling uncomfortable, you're not sure why they're asking it, please let them know, because that's going to be an important, could be an important key to your diagnosis. So some of the actions in regarding to managing this type of expectations: try to focus on describing your pain or limitations, and asking questions with less focus on what you think it is. So what you think the diagnosis is, what investigations or what treatments you think should be done. Initially, just allow the physician to ask all the necessary questions, whether or not it seems relevant. If you are uncomfortable answering a specific question, just say so. If you don't understand why a question is relevant, ask, because this gives the healthcare provider a chance to explain why they need that information. And if a form needs to be filled out, know that it may not be done until a full assessment has been completed, just as was indicated in the role play earlier. The next section here is talking about your pain. So this is the main reason why you're here. So you're going to have questions like, how did your pain start? What was the progress of that pain? Where is your pain? Where does it go? Where does it radiate? What does this pain feel like to you? How would you rate your pain? What makes your pain worse or better? How does it affect your function? The way I ask it, I will ask about what they think the diagnosis is, but I do that more towards the end. And I also ask about what fears, worries, or concerns about your pain. This is not a comprehensive list of all questions that are asked about it. And note that it may not be necessary for a healthcare provider to ask all these questions in order to make a diagnosis and determine in the next steps. Sometimes it's time limited. Sometimes some information is irrelevant to the symptom at hand, but just know that all of these questions don't always have to be answered in order to figure out what's going on and what the next steps are. So how did your pain start and how has it progressed over time? When you talk to your family doctor, try to discuss it in as chronological fashion as you can so they can develop an accurate timeline of how your pain started and changed over time. I've had a lot of difficulties in the past with patients where they tell me one thing and they jump to 10 years down the road, and they come to the current thing, then they go back to what happened 3 years later, and it can be very confusing to know actually how your pain progressed over time. If you don't know exact dates, because sometimes it's happened a long time ago, try to give a rough estimate. So I'm happy if someone says, oh, in the early 2000s or in 2010 sometime, or the spring of 2020. Is there an inciting event that actually started? Not just physically, but even keep in mind, was there a stressful event that happened in that time? How long have you had the pain? So usually this comes across after they've asked you the chronology of your pain, but just know that acute pain and chronic or persistent pain may actually have a different diagnosis or investigations or treatments, even just depending on how long you've had the pain for. What about when they ask, where is your pain and does it radiate? This is where you do need to identify the area of your most concerning pain. So you'll notice in the example, she simply said, oh, I have hip pain. He asked more specifics of where it is. She goes, I just kind of have hip pain. And she really didn't answer that question. When it comes to things like neck, shoulder, back, and hip pain, it may seem very obvious to you that that's where it is, but where in that area is also of huge importance. So pain into the back of the neck, to the side of the neck, the front of the neck, all of those things can actually be different types of pain generators. In the shoulder, you have the top of the shoulder, the front, the side, the back. In the back, you have upper back, lower back, and even buttock. And in the hip, as in the example here, you actually have the front of the hip where you're groin, the side or outside of your hip, and the back of the hip, which is kind of the buttock area. And then if they ask you where your pain is, try to include the two as if it goes anywhere, because that can be an important aspect. When you start to describe your pain in whatever way, again, this is where those preconceptions come in. Sometimes you may have a tendency or desire to tell them, my pain is osteoarthritic. And if you keep saying, you know what, it's osteoarthritic pain, or I have disc pain, or I have nerve pain, that's actually not very helpful for the healthcare provider, because saying that you have disc or nerve pain isn't really describing your pain, because disc pain or nerve pain can mean different things to different people. So we usually ask people to really focus on the actual symptoms and the area. So I have low back pain, which is sharp, rather than I have disc or nerve pain, or even that from that standpoint. So if they ask you how you would describe your pain, is it achy, dull, stabbing, throbbing, sharp pulling? If you're not sure, and if you have time even before your appointment, you can always pull up different descriptors for pain as well, but those are some of the standard ones. Note too that there is a difference between pain and symptoms such as numbness, tingling, and even pins and needles, because they can be different structural diagnosis. So for example, numbness, tingling, pins and needles can be nerve-related issues, but throbbing, aching, sharp can often be related to the muscle, joint, or bone pains. Pulling can actually be muscle or tendon, and burning can be muscle or nerve. So if you tell us you have nerve pain, we don't know if that means numbness, tingling, pins and needles. We don't know if that's burning, or if you or what the case may be. You'll be asked how you to rate your pain. So if you rate your pain on a scale of 0 to 10, 0 is it is based entirely on your prior pain experience. 0 is no pain at all. 10 is the worst pain you can possibly imagine. It is not the worst pain you've ever had. You define what a 10 out of 10 means, so that does not matter what someone else's 10 out of 10 means. If you feel that your pain varies, then give a bit of a range, how often your flare-ups occur and last. So my pain ranges from a 2 out of 10 to a 9 out of 10, or I get flares twice a week that lasts hours. What makes your pain worse or better? Let your healthcare provider know when you're asked this. Examples include things like weight bearing, standing, walking, non-weight bearing, like sitting and standing, bending, extending prolonged positions, or other activities. Sometimes letting your healthcare provider know what you think can help them confirm or your suspicions, or give them an opportunity to explain why they think it is different. So there is a role to know what you think, but it's not something that should be guiding your entire assessment. What are your fears, worries, or concerns about your pain? If the physician knows your fears, worries, or concerns, they may be able to confirm or alleviate the same with you. So examples of this mean, I have a fear of ending up in a wheelchair, or I'm going to lose my job. I won't be able to play hockey anymore, or I'm scared I won't be able to take care of my kids. So these are some examples of those. So some action items in general for this: be aware of and work to manage your expectations about your pain and your appointment. Think beforehand about the different aspects of your pain and consider writing it down prior to your appointment. That way, when they ask you a question of where your pain is, you've had a chance to think about it, or what makes it worse, you've had a chance to think about it, and you're not trying to come up with an answer while you're sitting there in your appointment. And the last part here is what to do at the end of your visit. There can be a lot of information and medical jargon when a doctor explains what they think is going on, or what's causing your pain, or what the next steps are, like investigations and treatments. This can actually be quite an overwhelming feeling, and you may miss some of those important items. So one of the action items here, if you can, or if there's time, is to simply summarize what your family doctor has said and clarify and your understanding of what the diagnosis is, the next steps, and who is doing what. So now let's kind of take another role play. Now that you're more aware of some of the factors that can affect your interaction, let's incorporate some of these actions that we talked about and see if you can actually identify them. Again, if you want, you can send your answers to question@painab.ca just to see, we can see if you can identify some of the different things that she has done to make things a bit better. So we will now start a role play and Action.
Hi, good morning. Hi, Sarah.
Hi, Dr. Jim.
Hi. Oh, it's been almost a year since I last saw you. It seems like forever. How are things going? How are the kids doing?
Oh, well, doctor, it's been strange with the pandemic. Everything's changed. The kids have been doing school from home for a while now, and just everything has changed. So it's been a very interesting and a little bit of a tough year.
Last year has been challenging for a lot of people. So what can I do for you today?
Well, I actually have a list of several questions, but the first thing is my hip pain.
Okay, good. We'll try to get through as much of that as we can today. If we run out of time, we'll discuss it at the follow-up appointment.
Okay. So I have pain in my hip. I wasn't able to get in to see you, so I went to a Mediclinic who did x-rays that showed that I have some hip arthritis. I think it was called mild arthritis, but it's really painful. I'm having a hard time believing that something like that feels this bad is just mild, and it has been getting worse.
Oh, that's really too bad. When did this start?
This started about a year ago. It gradually came on. I do remember it getting worse after a long hiking trip I took. I did quite a bit of hiking. I remember slipping on some loose gravel. I did catch myself. I finished the hike. I remember that it was quite bad at that point, and it's been getting worse since.
All right. So, so with that slip and this on the gravel, did you hit the ground?
No, I caught myself. I really stretched myself. I was very sore, but I was able to continue the hike. Later that day, it was quite bad. It was on and off, and now it's constant.
Okay, right. So where's the pain exactly?
So the pain is on my hip. It's on the right side. It's right on the outside of the hip.
Okay. And what's the pain like? If you were to describe it, would you say that it's dull, achy, sharp stabbing, burning electrical?
I would say that it is a very strong, achy pain, but I also get some sharp pains as well. And there's also some numbness on the side.
Okay. Numbness. So where is the numbness and tingling exactly?
It's on the outside of my thigh, and it goes all the way down to the top of my foot.
Okay, right. All right. So about the pain, when it's really painful, what do you do to make it better?
Well, resting makes it better. Heat helps. Tylenol and Advil have not helped, and laying down is better.
Okay, laying down better. So it's okay if you sleep then, right?
Well, I mean, typically I'm a side sleeper, but laying on my right hip has been painful, quite painful.
Oh.
So I've been sleeping on my back, and when I roll onto my side, onto my right hip, I wake up in pain. So it is affecting my sleep.
Oh, on your right side. Okay. What else makes the pain worse?
Okay, so the worst is going up and down stairs. It's really painful right on the right side. Walking for distances is also painful right on that right side again. And, I'm worried because when it gets to the point that it's affecting your work, I feel like maybe the arthritis is progressing. I mean, my cousin, who's the same age as me, had hip arthritis and had hip surgery. This did wonders for him. I'm wondering if seeing an orthopedic surgeon would help me.
Oh, okay. That is a thought. But before we discuss about a surgical referral, can I just clarify several more details? With your hip pain, is it worse with standing for a long time or sitting for a long time?
Okay, they are both painful, but prolonged sitting is worse for me.
Okay.
But what really hurts is rising from a sitting to a standing position.
Hmm. Okay, I know we talked about this before, but just to make it clear. So when you say hip pain, is it more on the side, like on the side, or is it in the groin, like the front, or the buttock, like the back?
Okay, when I've been sitting for a while, it's more painful in the buttock. Standing as well. Laying down on my right side is painful.
Okay, so to be clear, do you get groin pain with standing?
No, I mostly get lower back and buttock pain when I'm standing up, nothing in the groin.
Interesting. Interesting you say that, because oftentimes hip pain is most classically felt in the groin with prolonged standing, because it's a weight-bearing joint. And so if you're standing up, then gravity kind of pushes down on you more so. And so people report mostly is groin pain. The pain which you're speaking of, if it's on the side of your hip, is often due to other structures, one of them called a trochanteric bursa or an IT band, which is a muscle. Okay, with that, have you tried doing some physiotherapy or some exercises yet? This sounds like it would be a helpful first step.
Well, as I said when I first got here, it's just been really stressful this last year, and I've been really busy. I haven't had a lot of extra time. You know, when I'm done work, I feel so exhausted. I can't imagine doing too much more of anything. Sometimes I just feel like I need to lie down. I am worried about doing further damage to whatever this is. You know, I've gained some weight. I know that's probably not very helpful, so that doesn't make things really easy to exercise. And you know, the massage therapist said the muscles could only be this tight if this was, you know, serious arthritis.
Oh, wow! It's actually not even talking about the arthritis, but it sounds like things have been pretty tough for you recently, and just difficult to organize things.
Well, it has been. You know, my husband was laid off of his job during the pandemic. He worked out at the airport, and he's been home. He's been a bit down about that, actually. So with his sort of how he's feeling, and the kids trying to adjust to working, you know, at school, work from home, and me just juggling everything, it's I feel like I have more on my plate than I ever have had, and it seems hard to think about trying to do extra exercises, you know, and physiotherapy.
Yeah, fully can see how that would be challenging. All right, just getting back to some of the structural stuff you were speaking of. So with hip pain, there's actually possible multiple pain generators in the actual hip area. And to be clear, you have an X-ray, shows there's arthritis in your right hip, and I'm not saying that you don't have this. However, the symptoms that you described, the ones which sound like the ones that are causing most of your difficulties, are not actually in the groin. And so it sounds like your pain is coming mostly from a bursa, which is a little fluid-filled sac, or the IT band, which is a muscle which stretches right down to your knee, or possibly from the SI joint, which is in your back or your buttocks area.
Okay, so then physiotherapy wouldn't worsen the hip arthritis.
Good question. No, actually, it won't. And it's oftentimes the very first line of treatment in trochanteric pain, or actually even for hip osteoarthritis. So even if your hip was the cause of your pain, let's just say, and surgery was warranted and it's surgical in nature, the orthopedic surgeons will always suggest, will actually insist on pre-surgical and post-surgical conditioning and exercise.
Okay, well, I didn't know that. So I mean, if exercising is that important and it can make that much of a difference, and this is what, you know, it's required, then even though I feel like I don't have time for physiotherapy, I will find a time to squeeze it into my schedule.
Yep, well done on you. You're trying to do all the right things, even if it is tough. All right, before I continue, I just want to have a few more questions left. Do you have any fevers, chills, or night sweats?
No.
Okay. No physical traumas of any sort?
No.
Okay. Do you have any swelling?
I'm not exactly sure. Maybe my hip is swollen after activity, but now that you mention it, sometimes my fingers swell and it's hard to make a fist.
Your fingers swell?
Yes, sometimes they're really stiff and sometimes even warm in the morning, and sometimes they're puffy too.
Yeah, so you get a bit of stiffness in the morning, it sounds like. How long does it take you to get moving in the morning?
After about an hour, things seem to loosen up a little bit. And, you know, come to think of it, my hip is stiff in the morning too.
You know, with this swelling and stiffness in the fingers and some into your back and buttock area, there possibly could be a bit of an inflammatory component to this. So we'll give you a requisition for some lab tests to look for inflammatory markers just to be sure. And if these are found to be positive, it may be worthwhile to actually consult a rheumatology opinion. That being said, I still think that by far that the vast majority of arthritis is non-inflammatory in nature and technically doesn't require a rheumatologist, but to make sure, we'll just do some of these lab tests first.
Okay.
And is there anything else that you wanted to discuss with the appointment?
Just let me check my lists. I want to make sure I don't forget anything.
Great. So yeah, whatever we don't get through today, we'll definitely address this at the next appointment when I bring you in to do a physical exam as well too.
Okay.
As well as doing your form.
All right. So my question was, should I be getting an MRI scan to see what's really going on in the hip? Maybe it would make everything more clear.
Okay. So actually, MRI scans are not actually required to see osteoarthritis because it shows bony changes. MRI scans are meant to show more subtle changes like cartilage issues. But if you already have visible arthritis on an X-ray, this won't add much more because the cartilage is actually on top of the bone. So if you see bony changes, then it won't add too much. Hip surgeons do not actually need an MRI scan to look at this. They just need special X-rays. All right, so what other questions do you have for me?
Well, my other question or request was that I'm hoping you can fill out a form for me. My workplace refuses to give me accommodations. I mean, we do know that I do have hip arthritis, and they're still saying to me that there is no way that they can, you know, find some more sitting type roles for me. And in the last 6 months, I have missed several days of work. And of course, as I said, you know, being the only breadwinner right now, that really isn't a very good situation. I'm worried that I won't be able to continue, you know, working at my current pace, and I'm worried because they won't accommodate me. So I'm hoping you could fill out a short-term disability form. You know, I work in corrections, and I'm sure there's a sitting position that I could do. They're just not being very helpful.
Okay, so all right, so with regards to the form, we'll have to address this on another day because unfortunately I will need to have more information to fill it out adequately and give it the time and the dedication it needs because not every diagnosis affects the same patient the same in a work setting. So I need some specific information. But with regards to the clinical pain that you have, it really sounds like trochanteric pain more so than the arthritis stuff. And so we will be ruling out some inflammatory causes of pain.
Okay, I'm just really struggling at work with the pain right now.
Yes, of course. So in the meantime, there could be a consideration of looking into some pain management options because that's what's limiting you the most. Perhaps you can trial a topical anti-inflammatory cream that you can rub right on top of the painful side of you and make it easier to tolerate your work. And additionally, after that, we can also consider some other oral medications that could also make it easier for you to keep on doing your job.
Okay, well, I'm open to every suggestion you have. I mean, maybe even if I tried, you know, this anti-inflammatory cream you mentioned and you know, some other medications, maybe I wouldn't have to go on short-term disability.
That would certainly be the best outcome. So here's the plan. We will order some blood work and get some x-rays of your low back, tailbone, and your hands. Depending on the results of the lab test, we may consider a rheumatology referral to rule out the inflammatory component. I'll bring you in for a physical exam and dedicate some time specifically to get some more information and to fill out the form so it'll be useful for you. In the meantime, to help with the pain component right now, we'll book you for a diagnostic ultrasound of your hip to rule out that bursa, that little fluid-filled sac thing, or make sure that there's no muscle tear there. Then, depending on the results, there actually might be a role for a steroid injection into the bursa if it's inflamed and puffy and angry. I can prescribe you a topical anti-inflammatory to make your work easier to tolerate, and then makes it easier to start doing some stretching and strengthening exercises. So lastly, pain-wise, there could be a role for some medication to reduce the pain a bit and make it easier to engage in a corrective exercise program. And this will all help with that side pain in your hip that you speak of.
Okay, Dr. Jim, thank you. I will get all of those tests done that you arranged for me. I'll make sure that, I get them done as soon as I can. And I'm looking forward to talking to you again about this. I'm really glad we're finally getting somewhere with my pain. Thank you.
All right. Thank you very much. A special thank you again to Dr. Yen and Feline. They did an excellent job. They kind of put the whole script and the role play together. So I do appreciate that. So what actions were used? I don't know, Elizabeth, were there any kind of questions or comments that were posted from this last part?
So there were actually some coming in throughout. So I'll let you go over this slide.
Okay,
and then,
sounds good.
And then there's some really good questions for the group.
Sounds good. All right. So what actions were used? So some of the things, again, just to name a few, she did come prepared with a list of her expectations or some questions. So she was able to address those and refer to that a couple of times throughout the role play. She did have some medical preconceptions, but this didn't actually interfere with the doctor's assessment. Even though she had an idea of it, she didn't kind of keep pushing for it, to push for a specific diagnosis or treatment. She did allow him to ask all the questions that he needed. She was even more aware of her pain and could answer questions a bit more accurately. She was even able to identify some of her own psychosocial factors that may be impacting her ability to move forward with certain treatments. And interestingly, as a result of this, she actually had a different outcome than the first role play. So instead of being referred to an orthopedic surgeon, she was referred to a rheumatologist. So in summary here, just to know that there are several factors to consider prior to, during, and at the end of an appointment that can affect the patient-doctor or healthcare provider-patient interaction. You only have control over what you say or do, so really work to improve this part of the interaction. Be kind and compassionate to yourself in such interactions, because you are really doing the best that you can. You may not be able to remember all of these things, nor do we necessarily expect you to. And in fact, a lot of if the family doctor is able to ask all the questions, you won't have to remember a lot of these factors. And then again, asking them, letting them ask all the questions they need to complete the assessment. And one last thing, coming from a healthcare provider myself, be kind and compassionate to your healthcare provider, because we are also doing the best that we can given the circumstances. There could be time constraints. There could be our own issues that we have, our own beliefs about pain. And some of the same factors that apply to you can also apply to your provider as well. I will now switch to the question and comments section of the presentation today.
All right, that was awesome. And I just really want to echo how powerful that was to just see that contrast in terms of the interaction. And I would invite Dr. Yen and Feline to turn on their cameras, because I know the questions are sort of to the whole group. So we have some good questions. I think some of them are going to generate some good discussion. So one of the first ones was, what would a physician, and I'm going to say also to Feline, what would you consider the right patient attitude or approach when they come into an appointment?
All right, well, thank you for that question. I have been in a lot of pain and have have been in appointments where I could not focus on what I was trying to communicate. And so I think what Dr. Gonzalez has talked about is so relevant in taking care of yourself so that you can talk to your physician and communicate in the best way possible. So, you know, a good interaction starts, I guess, with us, the patients, and our attitude coming into that appointment.
What about for the physicians? Do you guys feel like there's a right approach or attitude that a patient or person with lived experience can come in with?
For me, a lot of it is just really having an open mind. I think the difficulty comes in when someone has a very specific agenda. They know it's arthritis. All they want is a surgical fix. They're not really open to everything else. So if they kind of come in with a kind of set thing in mind, now it's one thing if they're absolutely correct and we agree with them, then it's going to go exactly the way they want. But if their impression of what's happening is very different from what I think it is, this is where that disconnect comes, and it actually becomes very difficult to one, for educational standpoint, to help them understand what's going on, but even then just to move forward. And there's been some instances where I've hit that wall and we can't actually move forward. So I think having that attitude of an open mind and being actually, again, compassion, I think is a huge thing to yourself, what you're going through, about and to everyone around you, really.
Yeah, I would definitely, I would echo exactly what Dr. Gonzalez is saying here. For certainly, what I think is the biggest challenge is, yeah, it's the person. If it's the particular agenda and being, having a bit of a closed mind, because that actually does drive the interactions in a big way. And what often happens, and I've seen this before, is if somebody has they're very certain about the diagnosis and they're very, very certain about the ways forward. And there isn't that openness to explain alternatives or maybe a little bit in depth of possibly maybe there is a bit of a misconception here, or we can address it through more than one fashion and possibly address it. And there is a self-management component. Then we don't actually get that communication to let the patient know that there are more than one option. And that also becomes an issue when the encounter can actually be very short if the patient or the person just has the agenda and we don't meet that agenda. So then they will be referred to another person with this looking for the same agenda. And that may still not go that way, and then referred elsewhere and looking for this thing. And then so you may end up going quite along the line through multiple healthcare professionals without actually moving forward. And because the last thing is medical people speak medical talk. That's unfortunate. That's a very real thing. Every medical person, whether they are in the military or a pathologist or a medical student, or you do aerospace medicine, whatever it is, we all speak in really, really, really simple language. And we all have a general idea of certain things which lead us to certain treatments and diagnoses. But if it's always the same thing that we're looking for, and it's still bouncing off a bunch of different healthcare advisors, that may not actually change because we're only familiar with basic medical opinions.
I think that was really interesting to hear from all of you. And it's crazy to think that in the first role play, and someone actually did put this in, that in the first role play, Feline actually seemed a little resistant to some of the suggestions. Whereas in the second one, it was much more open. What do you think creates that defensiveness when you might be meeting with a healthcare practitioner?
Are you asking me, Liz?
I'm asking all of you, but I absolutely think it would be relevant for you for sure.
I think as a person with lived experience, sometimes that defensiveness is perhaps some poor experiences in the past where maybe you weren't heard, and it might have been your communication style, but ultimately you weren't heard and things didn't go the way you planned, or things took a really long time. Sometimes you've been in pain for so long that you're so anxious to get an answer that you're defensive and you're not even willing to listen to alternatives because they sound like they're wishy-washy, like they're not a real solution.
Mhm.
So those are some of the things that I think of when I've felt defensive in an interaction with a healthcare provider.
And maybe for the physicians, what do you think healthcare practitioners can do to help reduce that defensiveness or might contribute to that defensiveness?
I think that some of the things that contribute to defensiveness can be things like not validating them or dismissing their concerns and not actually addressing them or explaining them to things. And I think when it comes to communication, that's probably one of the biggest things, is that I've had patients kind of go through the whole system. They tell them that, hey, pain is all in your head. They just kind of dismiss what their experiences are. And they just it's kind of like the physician has their own agenda and doesn't necessarily take into consideration what the patient's desires or needs are. And so if you don't take that time to actually validate what they're feeling or validate their concerns, then it goes awry, because then they stop listening. Like my experience is, and if you feel dismissed and you need to be validated, then there's going to be resistance, because it's like, well, then you're not really listening to what I'm saying. And so why should I listen to you in that regard? So it is a two-way street. But actually, going again back to what we talked about before, is if they come in there with a specific agenda, then there's also that resistance. They don't want to hear anything else other than confirm what they know, right? And if it's a confirmation bias, so they're only looking for the things that will support their own preconceived diagnosis or next steps before they can kind of move forward.
So my thoughts about this is I fully agree with absolutely everything here. And treatment is a two-way street. And so this works way better when two people are working together versus when they are working in parallel and they are not working together. Mm-hmm. And so when the therapeutic relationship works better when I feel invested with I feel like what I'm saying, they're potentially also taking into account what I'm saying. And obviously the person with lived experience feels more invested. They feel like I'm listening. So if we're all communicating together and we can go to the same goal, then it generally works well. People generally, a lot of things that we may suggest as physicians may or may not make a whole lot of sense if we don't explain it. So even if things seem a little bit bizarre, if you see the rationale behind that type of thing, we explain it, then it makes it easier to see that it is a quote unquote real treatment. In addition, very much the same way, if the patient doesn't feel like that they're being heard, then it just doesn't sound like that we are doing any job of listening as well too. And it just really makes it think of your agenda, my agenda, two entirely different things. The last thing is just the disparity in when we're both coming to the same problem. So the person with lived experience, especially this goes after pain has been for a while and seeing multiple specialists and stuff, is we're coming to it very different. So certainly I'm speaking as a specialist, by the time you've seen myself, you've probably seen several different specialists online, and it's quite far down the way. And that journey has been going on for 5 years, maybe 10 years. But when I walk into the room, this journey has only started in the last 5 minutes. And I'm literally trying to pick up exactly where things are and trying to make sure we get most of the pathway. And so then that can cause a bit of resistance because it looks like you're repeating the same thing over and over and over again. But I literally have just walked into the room, and so I have to catch up really quickly on a bunch of stuff.
Amazing. A couple of folks did put in comments, and I think it's really interesting because they said in the second role play, the information, even though it seemed more conversational and it was a lot more back and forth, the information seemed more specific. There was much more detail and descriptive language. So I think the language was more verbose and more beneficial to both parties. And then the other piece was around being able to ask questions about really specific interventions. So is it okay to ask about something specific like exercises, positions? Is that appropriate to bring up at a healthcare practitioner appointment?
Absolutely.
As well as psychosocial stressors.
Yes, absolutely. Again, some of it's managing a bit of that time, but those are definitely things because that impacts it. If you have a question about that, I absolutely encourage people to bring that up. If I'm managing my time, I may have to make another appointment to address that. If I still have time left over, I can definitely address those things. So for my patients, I encourage them to bring up all that information. And the more I know for me at the beginning, as far as what they're expecting, then I can manage that time a little bit better. But absolutely, because all that impacts them and it also impacts their understanding of what's happening and maybe why exercise may or may not actually be helpful for them.
Awesome. Couple of rapid fire questions. Is it okay for patients to bring self-assessment tools or tracking that they've been using? Is that helpful to bring to an appointment?
I feel that is, it really depends on how detailed that is. So if it's literally like on an hourly basis, then I don't know that's not really going to provide as much information as I like kind of a general spread over time. But if it's literally the minute to minute, things change minute to minute for a whole bunch of different reasons. If you're, I don't know, hungry or tired or whatever it is, you watch a good show on TV. So then watching it from that amount of detail doesn't really tell me too much. But if you're looking at a bit globally over the last several months and that sort of thing, then yeah, that's good. And if you can, and ideally, if you can also identify some factors in that could have also done this, probably helpful.
Yeah, I agree. It's the extremes that's not so good. So not recording anything and not having any idea of your pain or kind of what's happening is definitely a deterrent because it's really hard to get that information to help diagnosis. But if you go on the opposite end to the extreme and you're so detailed, number one, we like to talk to you as a patient to get that information. If we end up spending the next 5 to 10 minutes just reading your diary, or what's happening, that's also going to take away from our assessment with you. So there is a happy place kind of in between. But one of the most important things is trying to see if they can identify the factors that may have led to exacerbations or what it is. Because just the fact that their pain was worse on Monday, but not on Tuesday, and then worse on Thursday, but not Saturday, that doesn't help you unless you can figure out, well, what happened those days. So too much information, not good. Too little information, not great. There is a happy place in between. But quite honestly, again, being compassionate, you do what you think you need to do. And then you can always ask your physician at this time, is this too much detail? Is this not? Because do you want to spend, every hour of a day documenting all of your pain and fine detail? Or do you actually want to use that time instead to do something you enjoy, like going out for a walk or doing something that could actually help with your pain rather than being so focused on your pain?
And to be clear, not everybody, but don't be surprised if not every physician wants to read it as well too. Like just from an expectation perspective, everybody has a different comfort level with this type of things. And if you have a very, very short appointment, that may or may not be something that there's time for. So yeah, but as a specialist, I've got a little bit more time to take a look.
And thank you. There were some questions about filling out forms, and I think that was pretty clear in the role plays that often those are the types of things that they do need a separate visit to be scheduled to make sure that those things happen. So thank you so much, guys. We are going to move on to the next segment. This was incredibly powerful. Thank you for sharing your lived experience in the role play, Feline, and Dr. Gonzalez, Dr. Yen. And I know we will see you again in a little bit.